So we've got the Summer Olympics, Major League Baseball, NASCAR, soccer, and soon football season. Well, there always seems to be an opportunity to catch sports on TV, but for men, sedentary time in front of that television can lead to serious health penalties. Here to tell us what we could do better with our well-being is Dr. Wanda Filer, president of the American Academy of Family Physicians. Good morning, Dr. Filer.
Good morning.
So tell us, according to your survey, how are men faring these days?
Well, we did a survey of men across the country, age 18 and up, and we compared it to a similar survey that we'd done back in 2007. And what we found in this survey is 52% of men around the country describe themselves as being in excellent or very good health. And I do want to point out that in the West, those numbers were even better. It was 54%. But when you start to also look at that group, they will tell you that many of those men have now been diagnosed with a chronic condition. And in the West, it's 46% of men have been diagnosed with a chronic condition. And what we asked about specifically was heart disease, high blood pressure, diabetes, stroke, and cancer. And many men have been diagnosed with this. Some of the good news is that men are doing a better job with exercise. They're working out more. It's 52% here in 2016 compared to only 38% back in 2007. So they've generally made some progress on that front, but there's still some work to do.
I agree. That's good to hear. Now, of course, we wouldn't know about any of these things unless we didn't see a professional. So how important is it to see a physician regularly?
Well, we generally recommend that every person have a usual source of care. In this country, that's typically a family physician. And part of that is because just because you don't feel sick doesn't mean that you're completely healthy. And so getting in and seeing someone who knows you, who's your partner in your health care, and also can help you to understand what prevention opportunities might be out there. That might be something like an immunization, but it also might be changing your diet. It might be eliminating tobacco or decreasing your alcohol use. Lots of different opportunities to take a look at the whole person and look at that patient in the context of their family, their community, even their workplace, and figure out what is it that's helping them to be healthy or what might pose a risk to them. That's where that relationship with a family physician really can come in handy.
Good point. Now, if you had to give guys one tip right now or a couple tips, what would you say to them would really improve their health very quickly?
First thing I would do is find a family physician. Have someone who knows you, who knows what you're all about. If you're afraid, think about why are you afraid and what are the barriers. Would it help to take someone with you? That could be a spouse, a partner, a loved one. It could be your friend, somebody who can make it easier for you. Write down what some of your health concerns are and bring them with you to the office. And realize you don't have to do it all at once. This is a relationship that you're building and hopefully building over a lifetime. So we can take care of you over many decades. The other thing is to really begin to know your family history. What kinds of things impact your first-degree relatives? By that I mean your parents, your siblings, your children, because those are things with which you might be at higher risk. And there are some things frequently that we can recommend that will lower your risk profile.
And you know, I don't think a lot of people think about this very often, and even younger men, for example, may think that they're either indestructible or they're not going to have illnesses for a while, but how important is it to start young?
It's very important to start young. You know, health is a lifespan commitment. And if you think about it, we take really good care of our cars. And I think many men, you know, you'll get your car in, you'll get it maintenance. This is even more important. This is important to think about where do you start. Maybe it's a once-a-year thing, and maybe you don't even need a test or much of a physical. What you really need is that conversation. But as you go through your lifespan and your risk factors may start to pile up, and age alone starts to become a factor, having someone who knows you and can help you kind of, if you do have a chronic condition, catch it early, get it under control so that you can continue to say, hey, I'm in excellent or very good health. That's really important to your long-term health care. Absolutely.
So if somebody needs a few resources to learn a little bit more about this, where can they go?
I would suggest that we have a website, familydoctor.org/men's health. There's great resources there around all sorts of men's health topics that hopefully many people will find very empowering.
Yes, Dr. Wanda Filer, thank you so much. Some very no-nonsense information that's very important to our life. Thank you so much.
Thank you.
All right, everybody else, stay right where you are. We'll be right back.